Hello students. So the topic is female reproductive system. So in this we are going to see the functional anatomy of the female reproductive system, then oogenesis, and then menstrual cycle and hormones regulating the menstrual cycle. Yes. So the life of woman can be divided into 3 periods. So from birth to menarche, and then from onset of puberty to the onset of menopause, and then postmenopausal period. So 3 periods. So if you take the reproductive years in females, it is between 12 and 36 years of age. So what is the fundamental difference between male and female reproductive system? So in female, there is a cyclical release of gametes, whereas in male, it is a continuous phenomenon in male from puberty till death. So cyclical release of gametes in females. So the cycles in females, they last for about a month. And this is due to the cyclical secretion of gonadotropins from pituitary. Because of cyclical secretion of gonadotropins from pituitary. So this monthly cycle is referred to as the menstrual cycle in females. So why it is called menstrual cycle? In Latin, the word menses means month. So it is called menstrual cycle. Is coming to the functional anatomy. So that external genitalia and internal genitalia. So external genitalia includes labia majora, labia minora, clitoris, vestibule of vagina, and vestibular glands. So these structures, they are collectively called as vulva. The external genitalia, the structures are collectively called as vulva. Internal genitalia, vagina, uterus, fallopian tubes, and ovary. So these are the female internal reproductive organs present in the pelvis. Yes, external genitalia. So external genitalia, labia majora, labia minora, clitoris, vaginal vestibule, and the vestibular glands. Labia majora. Labia majora, it is analogous to scrotum in males. Analogous to scrotum in males. So these are two major skin folds that forms the outer lip of the vaginal vestibule. So which includes the vaginal and the urethral opening. So major two skin folds. Labia minora, there are two minor skin folds present between the labia majora and forms the inner lip of the vaginal and the urethral opening. Then clitoris. So this is a female analog of penis. So this clitoris contains the erectile tissue. So this clitoris is located at the anterior pole of the vaginal vestibule. And then vaginal vestibule. So the vaginal vestibule contains two openings, vaginal and urethral opening. So vaginal opening, it lies below and posterior to the urethral opening. And then vestibular glands, it empties the secretion into the vaginal vestibule. So this is about the external genitalia. Then internal genitalia, see the vagina, uterus, fallopian tube, and ovary. So these structures form the female internal reproductive organs. So we will see one by one. Vagina. So this vagina, it is a tubular canal. So this is present anterior to the rectum and posterior to the urethra and bladder. So it is present anterior to the rectum and posterior to the urethra and bladder. So this vagina, it connects the opening in the vestibule to the uterine cervix. It connects the opening in the vestibule to the uterine cervix. If you take the length of vagina, it is about 8 cm and it is highly stretchable. And in the walls of the vagina, it contains the muscles. So contraction of vagina during the sexual act, it facilitates the transportation of sperm into the uterus. And then vaginal epithelium. So this vaginal epithelium, it changes during different phases of menstrual cycle. So in menstrual cycle, there are proliferative phase and luteal phase. So that you will be discussing, I will be discussing in the menstrual cycle. You just know what, you see what proliferative phase, luteal phase. So what happens to the vaginal epithelium in proliferative phase and luteal phase? In proliferative phase, so the hormone estrogen will be more, and because of the estrogen, there is a cornification of the vaginal epithelium occurs. So cornification of vaginal epithelium occurs, so that they secretes thin mucus. In luteal phase, the hormone progesterone will be more. So the cornification of the epithelium is reduced under the influence of progesterone, and there will be infiltration of polymorphonuclear leukocytes. So during the luteal phase, and the epithelium proliferates to secrete thick mucus in luteal phase. So this is about the vaginal epithelium that changes during the different phases of menstrual cycle. So this vaginal epithelium after menopause, it becomes thin and the secretions become scanty. So if you take the postmenopausal vagina, it's dry and they are susceptible to infection. The postmenopausal vagina is dry and susceptible to infection. So this is about vagina. See the vagina. Anteriorly you have the bladder and urethra, and posteriorly the rectum. So this is the relation to the vagina. Next is uterus. So uterus, this is the hollow organ having a thick muscular wall. So this uterus is placed between bladder anteriorly and rectum posteriorly. So it has two parts, corpus and the cervix. Corpus is the body of uterus and the cervix. So if you take the body of uterus, it contains two layers, myometrium and endometrium, and then uterine cavity. So in the body of uterus, there are two layers, myometrium, endometrium, and then the uterine cervix. Myometrium. So the myometrium consists of multiple layers of smooth muscle. So myometrium means multiple layers of smooth muscle. Endometrium. So the endometrium, there are two layers, stratum basal and stratum functional. Stratum basal is towards the myometrium. Stratum functional is towards the uterine cavity. So basal 1/3 is stratum basal, stratum functional is inner 2/3. So this stratum functional only, it will be periodically sloughed off and regenerated once in a month. So during the menstrual, the bleeding phase, so this stratum functional only will be sloughed off and regenerated once in a month. So the endometrium, stratum functional. See this picture, myometrium, and then you have the endometrium, and then will be uterine cavity. So towards the myometrium is the stratum basal, and then you have the stratum functional. So the stratum functional will be sloughed off once in a month and it will be regenerated. Yes. Next is the uterine cervix. So this uterine cervix is a narrow muscular tube that connects vagina with the body of uterus. Cervix connects the vagina with the body of uterus. In the cervix, it has an internal os, cervical canal, and external os. Okay. Internal os, cervical canal, external os. See this picture, external os is towards the vagina and internal os is towards the uterus, uterine cavity, and the canal. In between that os, two os is the cervical canal. So this cervical mucus, it changes. The consistency of cervical mucus changes from thick and viscous liquid to profuse, watery and high elastic liquid. So the mucus consistency changes depending upon the phase of menstrual cycle. So it changes from thick viscous liquid to profuse, watery and high elastic liquid. So this high elastic liquid, which forms the physiological basis for the Spin-Barkey test. So this is a test for ovulation, Spin-Barkey test. So Spin-Barkey refers to highly elastic substance. Highly elastic substance. This is a test for ovulation. So next is the fallopian tube. It is otherwise called oviduct. So there are two fallopian tubes arise from both sides of the upper pole of the uterus, and length of this fallopian tube is about 10 to 15 centimeter in length. So it has, so if you take the parts of the fallopian tube, interstitial part, isthmus part, ampulla, infundibulum with fimbriae. See this picture, interstitial part, isthmic part, ampullary part, infundibulum with fimbriae. So interstitial part is the part that is going inside the uterus, and then the narrowed portion is the isthmus, and then the ampulla, then infundibulum with fimbriae. So this fimbriae are nothing but the finger-like projection. Fertilization takes place in the ampullary part of the oviduct. So the fertilization occurs in the ampullary part of the oviduct, fallopian tube, and the fertilized ovum is transported to the uterine cavity for implantation. So ampulla, the fertilization occurs and the fertilized ovum will be taken into the uterine cavity for implantation. So this fimbriae, so see here, so the yellow one is the ovary and see the fimbriae attaching there. So during ovulation, when the ovum is released, this fimbriae will catch the ovum and will be taken into the fallopian tube. So that is the role of the fimbriae. Next is the ovaries. So there are two ovaries. So each one present on both sides of the uterus. So they are attached to the uterus by ovarian ligament. See the ovarian ligament. So this is one side. See the ovary is attached to the uterus by the ovarian ligament. There are two zones in the ovary, the cortex and the medulla. So cortex of the ovary, it is the outer major zone. Cortex is the outer major zone lined by germinal epithelium. And the cortex contains oocytes. So each oocytes, they will be enclosed within a follicle called the ovarian follicle. Each oocyte is enclosed within an ovarian follicle. And the matured ovarian follicle is called the Graafian follicle. See about ovary, so about the development of follicles, folliculogenesis, ovulation, all will be taken as a separate class in the next class. So just I am telling a few points alone relevant to this. So the mature ovarian follicle is called the Graafian follicle. So if you take the cortex of the ovaries, there will be various stages of development of follicles present in the cortex. Yes. See the cortex and medulla in this picture. See there are follicles present in the cortex with various stages of development. And the mature ovarian follicle is called the Graafian follicle. And then medulla. So it is the inner zone of the ovary. So this contains the interstitial and connective tissue cells. And the blood vessels and the lymphatics enters the ovary through the hilum. See the blood vessels, red and blue. So enters through the hilum. So in ovary you have the cortex and the medulla. Next, functions of the ovary. So ovary, like testis, it performs many functions. So oogenesis during fetal life. So oogenesis during fetal life, and then maturation of oocyte, then ovulation, then secretion of female sex hormones and peptide hormones. So these are the functions of ovary. The primary function of ovary is to develop the ovarian follicles and release ovum at the time of ovulation. So that is the primary function, and to secrete the steroid hormones, so that controls various reproductive and metabolic functions. Female hormonal system. So the major hormones that are present in the females are the hypothalamic releasing hormone GnRH, gonadotropin releasing hormone, and anterior pituitary sex hormones are the follicle stimulating hormone, luteinizing hormone, and then the ovarian hormones estrogen and progesterone. So these are the hormones, female hormonal system. These hormones only plays a major role in the female reproductive system. Yes, next is oogenesis. So oogenesis, it starts in the fetal life and ceases at menopause. So unlike spermatogenesis that starts at puberty and continues throughout the life, the process of oogenesis starts in fetal life and ceases at menopause. So the development of each oocyte that begins in the intrauterine life is completed with ovulation. See, the process of development of each spermatocyte is completed in few days, whereas the development of each oocyte that begins in intrauterine life is completed with ovulation that occurs during menstrual cycle. Yes, next, development of oocyte occurs in 3 stages. So the development of oocyte occurs in 3 stages. So first is oogonium becoming primary oocyte to secondary oocyte, and then secondary oocyte to mature ovum. So the oocyte development occurs in 3 stages. So we will see one by one. Yes, oocyte. So the primordial germ cells are called oogonia. So the oogonia are the primordial germ cells. So they migrate from the yolk sac of embryo. They migrate from the yolk sac of embryo to the genital ridge at about 6th week of gestation. And that oogonia undergoes many mitotic division. So what is mitotic division? It is cell division. So single cell divided into two cells with the same number of chromosomes. So this oogonia undergoes many mitotic divisions and becomes 7 million in number by 5 to 6 months. So mitotic division, oogonia, mitotic divisions, it divides to form 7 million number at 5 to 6 months. So when the mitosis stops, these oogonias are called oocyte. When the mitosis stops, these oogonias are called oocyte. So primordial germ cells are oogonia. So undergoes mitotic division to form the oocyte. So these oocytes, in the initial stage of development, it is called the primary oocyte. So in the initial stage, these oocytes are called the primary oocyte. Next, the primary oocyte, it undergoes a meiotic division. So actually the oocyte undergoes two meiotic division. So the primary oocyte undergoes the first meiotic division in fetal life. So the primary oocyte, it undergoes first meiotic division during the fetal life, which occurs about 8th week of pregnancy. 8th week of pregnancy. But this meiotic division gets arrested in the prophase. This meiotic division gets arrested in the prophase. So the primary oocyte, it undergoes first meiotic division in the fetal life, but this gets arrested in the prophase. So the first meiotic division is completed just prior to ovulation. So the first meiotic division which is get arrested in the prophase is not completed in the fetal life, not even till puberty, is completed just prior to ovulation. Which one? The first meiotic division. Yes. Atresia. So what is atresia? The process of degeneration of oocyte is called atresia. So the oocyte undergoes degeneration. So the oocyte degeneration, however, starts from intrauterine life. So at birth, there are about 1 million primary oocytes. At the time of birth, there are about 1 million primary oocytes. At the time of puberty, it is about 2 lakhs. And by the age of 30, only about 26,000 oocytes remain. Only about 26,000 oocytes remain in the ovary. And at menopause, the ovaries are virtually devoid of oocytes. So there is a degeneration of oocytes. So only 400 to 500 oocytes are ovulated, others degenerate. So during a woman's life, only about 400 oocytes are ovulated and the other oocytes degenerate. So the degeneration of oocytes is called atresia. Oocyte maturation inhibiting factor. So this factors only arrest the primary oocyte in prophase. So the first meiotic division got arrested in the prophase, that is by the oocyte maturation inhibiting factor. Next, the primary oocyte converted to secondary oocyte. So the primary oocyte got arrested in the prophase of the meiotic division. So meiotic division, it got arrested. This is called meiotic arrest. So the all eggs present at birth are primary oocyte in meiotic arrest, containing 46 chromosomes. So this state continues until puberty. So when this gets completed just prior to the ovulation. So the primary oocyte, the selected primary oocyte for ovulation completes the first meiotic division. The primary oocyte that is destined for ovulation completes the first meiotic division just before the ovulation. So it forms, after completion of first meiotic division, it forms the secondary oocyte and first polar body. So secondary oocyte, two structures, secondary oocyte containing 23 chromosome and other is the first polar body. So why it is called the polar body? See, because the cytoplasmic division is grossly unequal in this process. Because the secondary oocyte retains nearly all cytoplasm, whereas the polar body contains very little of it. So the polar body becomes completely non-functional. So it is called polar body. So when the first meiotic division completes, it forms the secondary oocyte and the first polar body. Next, the secondary oocyte forming the ovum. So I told you the oocyte undergoes two meiotic divisions. So first meiotic division over, primary oocyte. Now the second meiotic division. So second meiotic division occurs in the secondary oocyte. So this is after ovulation. So this second meiotic division which occurs after ovulation got arrested in metaphase. This got arrested in metaphase. So when the second meiotic division is completed, so when the egg is penetrated by a sperm, so when the egg is fertilized, so second meiotic division got arrested in the metaphase. When this will get completed, when the egg is penetrated by the sperm, so the meiotic division is completed only on fertilization. So as a result of this second meiotic division, the ovum containing the 23 chromosomes and second polar bodies are formed. These polar bodies are extruded. So thus in the process of oogenesis, each primary oocyte produces only one ovum. Each primary oocyte produces only one ovum. So see here, so starting from the oogonium, so the oogonia, the primordial germ cells, it undergoes mitosis to form the primary oocyte. So when the mitosis ceases, that stage is called those oocytes are called the primary oocytes. Then the primary oocyte, it undergoes first meiotic division which got arrested in the prophase. So this first meiotic division completes just prior to ovulation. And then the second meiotic division occurs in the secondary oocyte. And this got arrested in the metaphase. So this second meiotic division gets completed on fertilization. Okay. So during the process of oogenesis, each primary oocyte produces only one ovum. Yes. The ovarian changes during sexual cycle, it completely depends upon the follicle stimulating hormone and the luteinizing hormone. So all the changes that takes place in the ovary during the sexual cycle, it mainly completely depends upon the follicle stimulating hormone and luteinizing hormone. So the ovarian hormones that also will be taken in the next class, separate class in detail. Next comes the menstrual cycle. So far we have seen about the functional anatomy of the female reproductive system, about external genitalia, internal genitalia, and then oogenesis. So in the oogenesis the mitosis, oogonia undergoing mitosis to form the oocyte, that is primary oocyte, then meiotic division, secondary oocyte, then the second meiotic division to forming the ovum. So next is the menstrual cycle. See, the reproductive function in women exhibits cyclical changes. So that occurs regularly over a period of 1 month. So that cycle is called the menstrual cycle. So why this is happening means because for the preparation of the reproductive system for fertilization and implantation of the fertilized ovum. For fertilization and implantation of the fertilized ovum. So this cycle is called the menstrual cycle. The first menstrual cycle is called menarche. So the usual age for menarche is 12 to 14 years. 12 to 14 years. And if you take the length of menstrual cycle, it averages about 28 days. So the duration of cycle is never fixed in all women. Also, the duration of all cycle is not same in one woman, because there are so many factors that affects the menstrual cycle, like psychological factors, environmental factors, nutritional factors, social factors. All these factors will influence the duration of the menstrual cycle. So normally it ranges from 21 to 35 days. And the cycle is described by number of days. The first day being the day of beginning of the menstrual bleeding. And physiologically, the menstrual cycle ceases during pregnancy and lactation. Endometrial cycle. What is this endometrial cycle? Endometrial cycle is defined as cyclical changes that takes place in the endometrium of uterus during each month. So we see the endometrium, you have the seen the uterus, you have the myometrium and endometrium. So this endometrium, it undergoes cyclical changes. So during each month. So that we will be seeing during each phases of the menstrual cycle. So this is called endometrial cycle. So this endometrial cycle is divided into 3 phases. Proliferation of uterine endometrium, development of secretory changes in the endometrium, and then the desquamation of the endometrium. So 3 phases. First phase is a proliferative phase, second is the secretory changes, and then is the desquamation of endometrium is nothing but the menstrual phase, bleeding phase. We will see one by one. See this picture. In the left side, you have that ovarian events, endometrial thickness, day, uterine phase and ovarian phase. So ovarian event is the various stages of development of ovarian follicles. Endometrial thickness, see the thickness thin, then gradually increasing, again becoming thick. And the day 1 to 5 is the menstrual bleeding phase, that is a bleeding phase. And day 5 to 14 is the proliferative phase. And then day 14 to 28 is the secretory phase. Okay. And then again the menstrual phase. And then ovarian phase, you have the follicular phase, luteal phase. So in this endometrial changes, endometrial thickness, it changes. See, the endometrial thickness changes in different phases of the menstrual cycle. So menstrual phase la very thick, very small irukku. In proliferative, the thickness increases, and secretory, the thickness is more. Yes. First we will see the proliferative phase. We start with proliferative phase. So it is a estrogen phase occurring before ovulation. So before ovulation, see the dotted lines here. So that is the ovulation period. The top small round one is the ovum. So see the follicle after rupture, it's releasing ovum. The follicle, various stages of development of follicles. The top, various stages of development of follicles. So at the dotted lines, the ovum is released. At that stage, the ovum is released. So before ovulation is a proliferative phase. So in this phase, the estrogen is more. Estrogen from the follicle. Estrogen coming from the follicle. So if you take thickness of the endometrium after menstruation, only thin layer of endometrium is left. Only thin layer of endometrium is left. So under the influence of estrogen from the follicle, the thickness of endometrium increases from 5 to 14 days. So gradually thickness increases from day 5 to day 14, because day 1 to day 5 is the menstrual phase, bleeding phase. Then you have the proliferative phase. So that phase is under the control of estrogen. The thickness of endometrium increases from day 5 to day 14. Yes, how the endometrial thickness increases? So re-epithelialization within 4 to 7 days occurs. There is a re-epithelialization, and the uterine endometrium undergoes hyperplasia and hypertrophy. So this increases size and thickness. Because of hyperplasia and hypertrophy, the thickness increases. And the endometrial glands, it lengthens, and the glands are drawn out. The glands are lined by columnar epithelium. And then the spiral artery increases in the endometrium. So the endometrium is vascularized with the formation of more number of spiral arteries. So that increases blood supply to the deeper layers. So this increased blood supply promotes further growth of the uterine mucosa. So this increases the thickness, and the endometrial veins also grows in size. Endometrial veins also grows in size. So all this will increase the thickness. So 3 to 5 millimeter thick at the time of ovulation. The endometrial thickness is 3 to 5 millimeter thick at the time of ovulation. See, estrogen, the dotted line, then progesterone. See the thickness, it gradually increases around 3 to 5 millimeter. So next is the secretory phase. So this phase is under the control of progesterone, occurring after ovulation. So this is occurring after ovulation. So after ovulation, both estrogen and progesterone hormone will be there, but predominantly the progesterone, all the changes are mainly because of this progesterone. So estrogen and progesterone secreted from corpus luteum. So what is this corpus luteum? See, corpus luteum is nothing but, see, after the ovarian follicle ruptures, after the release of ovum, this ruptured follicle will be filled with blood. So ruptured follicle will be filled with blood. So that stage is called corpus hemorrhagicum. So but gradually this blood will be replaced by luteal cells. So at this stage it is called corpus luteum. Corpus luteum. So this corpus luteum, it secretes hormones, estrogen and progesterone. So but major hormone is progesterone during the secretory phase. And estrogen causes additional proliferation. So this progesterone, it causes marked swelling and secretory development in the endometrium. So how this occurs? So here the uterine gland becomes coiled and tortuous. and the glandular cells, they store glycogen and secretes large quantities of carbohydrate rich mucus and fluids. So that's why this phase is called secretory phase. And then the vascularity of endometrium increases further. So due to the combined effect of estrogen and progesterone from the corpus luteum, and the spiral arteries becomes tortuous, and then the endometrium becomes edematous and thick. So why the endometrium becomes edematous thick? Due to increased blood supply and increased secretion, the endometrium becomes edematous and thick. So all this will occur during the secretory phase. During the secretory phase, all this changes will occur. So this will also increases the thickness of the endometrium. Next is the menstruation. So what happens in the menstruation phase? So the corpus luteum degenerates. So during the menstrual bleeding phase, the corpus luteum degenerates. So when the corpus luteum degenerates, the hormonal support of endometrium is withdrawn. So this causes the endometrium to become necrotic. When the corpus luteum degenerates, if fertilization does not occur, the corpus luteum degenerates in about 13 days after ovulation. If fertilization does not occur, the corpus luteum degenerates in about 13 days after ovulation. So degeneration of corpus luteum, so there is no hormones from the corpus luteum. So hormonal support is withdrawn. So that lead to endometrium becomes necrotic. So what is the mechanism here? So because of the decreased secretion of the steroid hormones, reduction in the steroid hormones, it causes destabilization of the lysosomal membranes in the endometrial cells. So that leads to a release of proteolytic enzymes and production of prostaglandins, especially PGF2 alpha. So this proteolytic enzymes causes lysis of the endometrial tissue. And this prostaglandin causes vasospasm. It constricts the coiled arteries. So all this will lead to decreased blood supply to the endometrium. So there is a necrosis of endometrium. So decreased blood supply, that leads to necrosis of endometrium, and there is a sloughing of the uterine endometrium. So there is a vasospasm of coiled arteries because of the prostaglandins. So ischemic changes resulting in area of local necrosis, and then this focal necrosis, they join to form a big necrosis that result in sloughing of the uterine endometrium. So this is the mechanism behind the menstrual bleeding. The corpus luteum degenerates. So the blood loss, if you take, the serous fluid is about 35 ml and blood is about 40 ml during the menstrual bleeding phase, and there is a fibrinolysin present in the menstrual fluid. So this fibrinolysin, it prevents clots formation. So when it comes out, when the blood comes out of the uterus, it will not clot because the fibrinolysin is present there. So this prevents clotting of blood, the fibrinolysin present in the menstrual fluid. And also, the menstrual blood contains tissue debris, prostaglandins, and I already told you fibrinolysins. So the normally 30 to 130 ml of blood is lost. So what happens in menstruation? So how the bleeding occurs? So because of this corpus luteum degeneration. If fertilization does not occur, the corpus luteum degenerate, hormone support withdrawn iodine. So there is a release of proteolytic enzymes and prostaglandins. So there is a vasospasm, ischemia, necrosis, and then sloughing of endometrium. So this is about, so these are three phases of the menstrual cycle. So proliferative phase, secretory phase, menstrual phase. So once the endometrium is left off, the endometrial thickness becomes very thin. So again the proliferative phase starts. Under the influence of estrogen, the thickness increases. So this cycle repeats every month. So next, phases of menstrual cycle. So phases of menstrual cycle, you have the follicular phase and luteal phase. The two are separated by ovulation. So you have two phases, follicular phase and luteal phase, separated by ovulation. First, follicular phase. What is follicular phase? The follicular phase, it starts from onset of bleeding to the day of ovulation. Follicular phase means onset of bleeding to the day of ovulation. So that means it includes the menstrual phase and the proliferative phase. we have seen no 3 phases: menstrual phase, proliferative phase and secretory phase. So in that menstrual phase and proliferative phase are included in the follicular phase. Luteal phase means between ovulation and the onset of next bleeding. So luteal phase. So this luteal phase is constant. It is 14 days. So between ovulation and the next bleeding, onset next bleeding. So that is the luteal phase. So next changes in the reproductive organs. So what are changes in the reproductive organs? Follicular phase. So ovarian changes that will be taken in a separate class about the development of the follicles, that you will be seeing in the next class. Uterine changes we have already seen. So that is the menstrual phase and the proliferative phase. What are the uterine changes? So we have seen so how the thickness endometrium increases in the proliferative phase. That is uterine changes. So yes, next is changes in the uterine cervix. So changes in the uterine cervix. So under estrogen, the major hormone in the proliferative phase is the estrogen. So the volume of cervical mucus increases and the alkalinity and elasticity of cervical mucus increases in follicular phase under the influence of estrogen. So what are the vaginal changes in follicular phase? So under estrogen we already seen the epithelium becomes cornified. So this one we already seen in the beginning itself. Luteal phase. So luteal phase, ovarian changes, uterine changes. Ovarian changes that will be discussed separately. Uterine changes is nothing but the secretory changes that are occurring during that phase. After ovulation, under the influence of progesterone, all the secretory changes that comes under the uterine changes. And changes in the cervix. So progesterone is the major hormone there. So cervical mucus become thick and the elasticity decreases. And vaginal changes, the secretion becomes thick and the epithelium is infiltrated with leukocyte and the cornification decreases in the luteal phase. So why it is called luteal phase? Because the corpus luteum is formed there, because of that it is called the luteal phase. You see this picture. From the top, the hormone releases from the hypothalamus GnRH, then from anterior pituitary FSH and LH. See, there is a various stages of development of the follicles, and then ovulation, then the formation of corpus luteum. So from the corpus luteum, progesterone estrogen hormone is coming. And then the phases: menstrual phase, proliferative phase, secretory phase. And major hormone, see, estrogen is a major hormone in the proliferative phase. Progesterone, estrogen both are there in secretory phase, but progesterone is the major hormone in the secretory phase. And the line is the ovulation. Okay, and follicular phase and luteal phase. Yes, next comes to the disorders of menstrual cycle. So you have amenorrhea, hypomenorrhea and oligomenorrhea, dysmenorrhea, menorrhagia, metrorrhagia, polymenorrhea. What is amenorrhea? Absence of menstrual cycle is referred as amenorrhea. So this amenorrhea have primary and secondary amenorrhea. Primary amenorrhea means when the menstruation has never occurred. That condition is called primary amenorrhea. Secondary amenorrhea means that woman previously had normal cycles, but currently the menstrual cycle stops. So that is called, due to some reason, the secondary amenorrhea occurs. So if you take the primary amenorrhea, you have the physiological causes and pathological causes. Primary amenorrhea physiological causes before puberty. So in normal childhood and prepubertal age. So that is primary amenorrhea. Pathologically, you have the congenital genital defects. Because of congenital genital defects like Turner syndrome and Kallmann syndromes, so the pathological primary amenorrhea occurs. So primary amenorrhea means when the menstruation has never occurred. Secondary amenorrhea, previously you had normal cycles, but now the menstruation stops. For the secondary amenorrhea also you have physiological causes, pathological causes. So physiological causes, it is pregnancy and lactation. Pregnancy and lactation, the secondary amenorrhea occurs. Pathological causes, hypothalamic disorders, pituitary disorders, ovarian disease, any uterine pathology or any systemic illness. So all this will cause secondary amenorrhea. So this is about amenorrhea. Hypomenorrhea. Hypomenorrhea means decreased menstrual bleeding in duration or amount or both. So this is called hypomenorrhea. Oligomenorrhea means decreased frequency of menstrual cycle. That is cycles more than 35 days. That is called oligomenorrhea. So hypomenorrhea means the menstrual bleeding decreased in duration or amount or both. Whereas oligomenorrhea means decreased frequency of cycle. That is more than 35 days. So that is oligomenorrhea. Dysmenorrhea means painful menstrual bleeding. Dysmenorrhea is called painful menstrual bleeding. So there are two types, primary and secondary. So primary, there is no visible pelvic pathology. Secondary means there is some pathology, any uterine or pelvic pathology is associated with it. So dysmenorrhea is painful menstrual bleeding. Menorrhagia. So menorrhagia means increased menstrual bleeding in amount, duration or both. So this is called menorrhagia. Metrorrhagia means bleeding occurring between periods. So in between periods, they will have a bleeding. So that is called metrorrhagia. So this usually indicates some surface lesion in the genital tract. So that may be benign or a malignant. And then polymenorrhea. Polymenorrhea means when the menstrual cycle occurs frequently. So this polymenorrhea is opposite to oligomenorrhea. Here the menstrual cycle occurs frequently, less than 21 days. So this is called polymenorrhea. So these are the menstrual disorders of menstrual cycle. So to summarize, you've seen about the functional anatomy, oogenesis, and in menstrual cycle, so you have the three phases of the endometrial cycles. So proliferative phase, secretory phase, and the menstrual phase, bleeding phase. And then the major two phases in the menstrual cycle are the follicular phase and the luteal phase. And then the disorders of menstrual cycle. Thank you.